Okay, I guess we can go ahead and get started. We're going to keep this very informal. I want to just present a general overview. A lot of our other webinars involved how enzymes help more specific problem areas, especially those related to the GI problems related with children with autism. But that tended to make people think that only those who needed enzymes were those with spectrum type disorders, and it's not really true. The enzymes can actually be beneficial to just about anybody, and as I hope to show you here, that a lot of us have problems. Sometimes we just take for granted that some of the problems, digestive problems we have, are something we have to live with, and it's not really true. Really, digestion should not be a painful experience. So what we're going to do is basically show you how it works and what should be happening, and if it's not working completely right, well, the enzymes can often do a good job of helping. Okay, let's see if this works. There we go. This is just a little disclaimer. This is not meant to be any type of medical advice, especially for treatment or diagnosis of any kind of disease. And I do urge you, if you are having serious digestive problems or you're just not sure what's going on, please go see your doctor. And just for your peace of mind, just to rule out any kind of health problem that may be more serious than what you think it is. So we are going to talk about digestive type problems, and it's something that everyone will experience at some time in their life. In fact, GI related problems are probably the most common medical complaint found, and it accounts for a lot of lost work hours, a lot of missed school days, and we're going to see where and how some of these problems turn up. But they can range from anything from the common maladies like heartburn to hemorrhoids, which, even though they occur on the lower end of the GI tract, they can be related to the digestive process. And as anyone who has grandparents can attest to, that digestive problems will increase as we get older. So this is one of the most common problems associated with aging. And so we find in our experience that enzymes can be especially helpful to the elderly. And so in fact, I live in a town that has quite a large geriatric population, and they're probably our largest walk-in clientele, and it's usually just through word of mouth. But it's just amazing how often these problems crop up. I've talked a little. Anyone who's heard me speak before know that we like to describe how digestion works, and it's something we take for granted. We do need to eat to survive, but really the purpose of ingesting food is it's a way to provide the body with a fuel source, and also the raw material, the building blocks we need for growth. Everything that goes on internally within the body requires a fuel source, whether it be a sugar or other chemicals or hormones or such. And a lot of the stuff that the body needs, it can't obtain directly from the environment. It has to manufacture that. And for example, the proteins that comprise muscle, the cartilage, the bone, all those have to come from the outside. The calcium for making bones, the glycosylated aminoglycans needed for cartilage growth, all that we need to get from the things that we eat. So the way to do that, though, these things are just not laying around already prepared for us. They're found within different foods. So we first have to break down these foods that we eat. One, mechanically break it down through the process of chewing. And then there's also chemical dissolution as well that goes on in the stomach. enzymatic breakdown, and that occurs pretty much the whole length of the GI tract. And all of this is to break down the food that we eat into the smallest possible unit. And once it's broken down, the body can then reassemble these components and make it into the specific chemicals it needs to make its own unique substances that requires for human growth. So the digestive tract is presented with a variety of materials to handle. So the body's developed a number of different mechanisms to cope. We have different enzymes. The enzymes, there's basically three food groups. There's the proteins, carbohydrates, and fats. And that's going to comprise a little bit of each is found in just about every food that's eaten. But it comes in different quantities, different proportions. So the body has developed different ways to deal with each substance. So we have enzymes to break down proteins. We have enzymes to break down carbohydrates into sugars. We have enzymes to break down fats into and lipids into essential fatty acids. Now, a lot of people who are big proponents of raw foods like to talk about raw foods being a good source of enzymes, and it's true. Enzymes are something that you won't find in cooked food because they can't withstand high temperatures. So any food that's been cooked or processed, canned, exposed to high temperature or acid conditions usually is going to be have little to no enzyme activity. But what a lot of people forget to mention is that the enzymes found in raw food is at such a low quantity, it's just enough to basically rot that food. The purpose of an enzyme in an apple is to allow the apple to disintegrate once it's dropped from the tree, and that way the seeds, it's a way for the tree to propagate itself. Basically, once the apple falls from the tree, hits the ground, enzymes start working to break down the fleshy part of the fruit, and then the seeds are able to get into the ground. And actually, the digested fruit material provides a nutrition for the seed within the ground as well. So for the purpose of digestion, the enzymes that you find in raw foods, while they are beneficial, are really too low to help that much with the digestive process, because digestion has to occur in a matter of hours. And as you all know, if you watch a banana in your kitchen counter, it takes several days for it to turn from green to brown to mush. So digestion has to occur a lot quicker. So while raw foods are generally good, that we do have to be careful about bacteria and such. No one wants to eat raw chicken and deal with getting the bacterial infection that may result. But sure, raw foods are good, but they're good for a variety of other reasons besides just as a source of enzymes. But luckily, the enzyme supplements provide much higher amounts of enzymes and can help digestion a lot quicker than raw foods could. Okay, different types of stomach problems. This can run a whole. We talked about autism spectrum disorders. There's a whole spectrum of different stomach and GI problems. Some of the main ones we hear about today are reflux and heartburn, and we know you can't turn on the TV without hearing some commercial about Nexium or Prilosec or Prevacid. All of these things or Tums to help the acid stomach or the reflux and heartburn that occurs. We have to have acid in the stomach. It's necessary for digestion. It basically kickstarts the enzymes later on down in the GI tract that come from the pancreas. The acid, though, if it's produced too much or in too large of a quantity, can kick up into the upper part of the stomach and start damaging the esophagus, and that's not good. A lot of people who have acid reflux will use antacids like Tums or calcium carbonate tablets, those type of things. And while they provide a temporary relief, there's something called a rebound effect. The stomach wants to regulate the pH in the stomach. It wants to keep it, especially when there's food present, it wants to try and keep the stomach as acid as possible. So if you eat a meal, sure, the stomach is pumping out acid because it wants to activate the enzymes that are required to start the digestive process. So if you put an antacid in there, which neutralizes the acid and raises the pH, the stomach is going to respond sooner or later. It's going to respond by just making more acid or signaling the stomach cells to produce more acid. So it becomes a vicious cycle. You feel the acid in your stomach, you take Tums and it helps for a while, but then more acid starts and you just keep taking them, and it's not a good thing to have happen. The acid blockers, on the other hand, they directly turn off the acid pumps, and this can be helpful if reflux is a problem. And I'm not against them per se, but I tell anyone who's taking these acid blockers that they really need to take a good enzyme product along with it, because if you have a low acid condition in your stomach, one of the things that's going to happen is you don't have the acid or the low pH there to jumpstart the body's own digestive enzymes, which are there but are only activated in the stomach at pH 5 or less. And so if you don't have the acid there and the pH is too high, you don't have the inactive enzyme becoming activated, and which would then activate the pancreatic enzymes later on. So for that reason, it's a good idea if you're taking Prevacid and Prilosec or these others to add in a good enzyme product along with it, and you'll get the best of both worlds. Whenever you're having any kind of stomach problem, always try to identify what food is causing the problem. Is it a protein? Is it some type of carbohydrate or sugar? Is it fats, or is it a combination? The reason we ask is certain enzymes can help more than others, so you want to try and match the food, the problem food, with the enzyme that can help alleviate that problem. And really the goal of the stomach, especially when you're talking about reflux and GERD and those type of things, you want to get the food processed and moved out of the stomach as quickly as possible. Because once the food is out of the stomach will stop producing acid. There's no reason for it to produce acid. And also you don't have the liquid in there and the volume in there that would make reflux more likely to occur. So often multiple enzyme combinations is best, because let's face it, we don't eat just protein or just carb or just fat. Everything we eat is usually a combination of something, so of all three. So you want to take something that will break down all three, just to be on the safe side. Gas and bloating. Nothing is funnier than the good old fart joke. So that's something that in our culture is something we giggle and snicker about. So it can be a social problem. And I do get emails from people who say they just really have a severe gas problem, and it just causes them a lot of social anxiety and embarrassment. But we do have to realize that passing gas is normal. In fact, we should be doing it 10 to 20 times per day. And we really just need to try and remove the stigma from it. However, on the other hand, a digestive tract that's healthy shouldn't be passing gas that's obnoxiously smelly. So most of the gas in the GI tract is carbon dioxide and methane, which has no, in and of itself, has no smell. If there is a bad odor to it, it's usually an indication that there's something else going on. And usually maybe that you have a certain type of bacteria that really shouldn't be there, but it's bloomed and is in there, and in large amounts, and it's producing gases like hydrogen sulfide, which would have a sulfury, rotten egg odor to it. Also, if the enzymes aren't really in balance or aren't there doing their job, or certain foods are not being broken down, what we have is a which we call putrefaction process, or basically just rotting. The food is not being broken down; it's just rotting in the GI tract, and that's not a good thing. It serves as a food source for the bad bacteria, and which just increases the problem. You get more gas, and it's the smelly, bad kind. There are certain foods that we eat that we just don't have the enzyme. We don't produce the enzymes to handle them. Beans and broccoli come to mind, and they contain very complex carbs called stachyose and raffinose, which we don't, our excuse me, and digestive tract don't produce the enzymes to break down stachyose and raffinose. So those just go through the gut undigested, and that serve as a food source or a gathering point for the bad bacteria. However, there is an enzyme, we don't make it, but you can take it, called alpha-galactosidase, and that's the enzyme you find in products like Beano, and our Zyme Prime and Zyme Carb, and many other enzymes on the shelf contain this enzyme as well. And it can specifically break down these type of carbohydrates, stachyose and raffinose. So that's how they help. But really, you really need to start being aware of what you're eating and what's causing the problem, and sometimes you just have to eliminate it, or just figure out, take a good enzyme product that'll stop the problem. Let's see. Other types of stomach problems. There's other stomach issues, and that there are other things besides enzymes that can help, and we try to identify those, and they're usually things that you can find quite easily. The first thing, if you have just generalized stomach upset, the rumbly, we'll call the rumbly tumbly type of thing, where you just feel things kind of gurgling around, try using an enzyme to break down carbs. And the reason is, when you break down carbohydrates into sugars, you get a kind of the fluid in the stomach becomes thicker. It actually becomes kind of syrupy. It's just like if you were adding sugar to a water mix, and you're mixing together, and you notice that the water gets thicker as the sugar dissolves in it. Same way, if you're breaking down the carbs, you're turning carbs into sugars, and that tends to just have a settling effect, a syrupy effect on the liquid in the stomach, and that in and of itself can sometimes be rather soothing. It's the reason why sometimes taking some syrupy kind of medicine helps calm the stomach as well. But things like ginger, and I keep a lot of this around. Tai Ling makes one called crystallized ginger slices. I think it's very good. Now, some people think it's too strong or too hot or something, but I really like it. I find it to be something very good to settle the stomach. Fennel, a little tea made out of fennel, or just chewing on some fennel can be helpful. And peppermint oil is another thing that can soothe the stomach as well. So these are things you can try in addition to the enzymes. And if the enzymes alone aren't giving enough help. One thing to be very conscious of, if you eat a high-fat meal, it's going to take much longer for that food to get out of the stomach. Fats tend to slow the stomach's working mechanism down. So it takes longer for food to get out of the stomach when there's fat there. But you can take a good lipase enzyme product. Lipase breaks down triglyceride fats, and that can help the process. Once the food gets broken down or into a certain consistency in the stomach, then the stomach is allowed to empty. But the GI tract doesn't want to take a lot of large chunky material, so it needs the food mass to be, it's called chyme, C-H-Y-M-E, to be a certain consistency before allowed to pass into the small intestine. It's about taking hydrogen chloride or hydrochloric acid or betaine hydrochloric along with the meal. And the acid in the stomach is hydrochloric acid. It's not severely acidic in the stomach, though the pH may be kind of low. It's not a real strong acid content, so it can be easily buffered. But a lot of people find out when they take hydrochloric acid that it helps with digestion. Well, what they're really doing is they're providing an acid environment to kickstart the pepsin enzyme that is in the stomach. And once pepsin is activated, it can then activate other inactive digestive enzymes. But if you're taking an oral enzyme supplement, they're already active. They don't need acid. And to be honest, sometimes these enzymes will work better at pHs a bit more toward neutrality. So by taking hydrochloric acid with the enzymes, you may not be getting the optimal benefit from the enzyme itself. So if you're taking an enzyme supplement, there's really no need to take the betaine or the hydrochloric acid. You can just leave that out, pocket the money. And this is one area the elderly can present stomach digestive problems that can be helped by enzymes, because as we age, a lot of times those enzymes stop being produced, or they're not produced as much as they used to. One thing that's very noticeable for us, or just about anybody, that gives you a clue as to what old age is going to be like, is lactose intolerance, because lactase enzyme is one of the first enzymes to shut down. And usually anybody above the age of 35 or 40 will be lactose intolerant. But again, you can take an oral lactase enzyme like lactate, or many other enzymes contain the lactase enzyme and get the benefit. What about ulcers? Ulcer is basically a hole in the lining, the mucus lining of the stomach, which allows a bacterium called H. pylori is what causes ulcers. It's not just acid, it's not just worrying or emotional upset. It's actually a problem with the bacterium. And it can be treated by taking certain antibiotics that kill off the H. pylori. Enzymes aren't going to treat or prevent ulcers. We always caution people, if you have a severe bleeding active ulcer, you may not want to take an enzyme just because it might, basically have an open wound in your stomach, and the high proteolytic enzymes, while actually might be helpful by debriding the wound, it also exposes the wound to the acid, and it may be a little bit painful. So certainly with children, we don't want to do that. So if they have any kind of bleeding or ulcerous condition, we recommend using the more gentle enzymes and not the high protease enzymes. So that's just a little extra in there. Intestinal problem. We move down from the stomach down into the intestinal tract, and I've just listed some of probably these are the top 6 problems: constipation, diarrhea, different types of food intolerances, and irritable bowel syndrome, or IBS, and diverticulosis, and Crohn's. And they're sort of like listed in descending order, or listed in order of severity, with constipation being the least severe and Crohn's being the most severe. We're going to talk about each of these individually. Constipation. This is probably something we hear most about. I know kids dealing with autism seem to have either diarrhea or constipation, or go back and forth, but it seems like constipation is a little more of a problem. But it can occur in any of us, and probably all of us have had at one time in our life, or several times we've had problems with constipation. I know as you get older, you get more concerned about when and how much about your bowel movements. So it's very reassuring to be on a very regular schedule. So some of the things to take into consideration, our diet is, those diets that are high in processed foods have little bulk, or just not much fiber in them, have a lot of starches, tend to be things that tend to make us more constipated. Low gut motility, when the gut is just kind of sluggish, that can also result in constipations. Actually, when you have diarrhea, the medicines you take to treat the diarrhea often work by slowing down the gut. The idea being that if you slow down the gut, you allow time for the water in these stools to be absorbed, and so you get less fluid and less diarrhea. But it can also have the opposite effect and cause constipation as well. And many medications can result in constipation. Even some vitamins, high iron diets, a lot of iron in the diet can cause constipation. But many of the medications that kids are on, constipation is one of the side effects. There are some enzymes that can soften stools, especially when eating vegetables and high fiber foods. And this is a good time to kind of remind people that an enzyme works based on what you are eating with it. For example, we talked about lactase. If you take a lactase enzyme but you don't have any lactose containing food, you didn't drink the milk or eat the cheese or dairy product, then the lactase isn't going to do anything, because enzymes are very specific in what they do. Lactase is only going to work on lactose. We have different kinds of protease enzymes. They all work on different kinds of proteins, but they're not going to work on carbohydrates. They'll just work on proteins. So if you're eating a high carb meal and you are relying only on proteases, it may not do that much for you. Sure, it'll work on the proteins that may be there with the carbs, but you also have to have, and if carbs especially are a problem, then you need to make sure you are taking an enzyme product that has the right kind of carbohydrates to attack the starches and the carbs. So that's something you can go to our website and look at the FAQs and read some of the articles and get a clue as to what's going on there. Those who deal with constipation, we try to keep the starch processing enzymes to a minimum. They can make the stools firmer. For example, our Zyme Prime enzyme is very good at breaking down carbs and lactose, and it's got the alpha-galactosidase, such. But if you're already on a high processed food diet, or there's not a lot of fiber in your diet, then that enzyme might just make the constipation worse by drying up and firming up the stools. It's great for diarrhea or loose stools, but if the opposite is the problem, then you want to avoid the starch processing enzymes. There are other, let me go back there. For example, there is one product we sell called Nophenol that has what we call the cellulosic enzymes, like cellulase and xylanase, are two enzymes that tend to break down insoluble fiber into a soluble form, which is good if you have constipation, because then you have sort of it tends to make the stools a little bit mushier and easier to pass. So if constipation is a problem, you don't have you reduce the straining and exertion required to pass the large hard stools. So but those enzymes, the cellulase and the xylanase, is only going to work if you have some fiber in your diet for the enzymes to work on. So again, keep that in mind. On the other end of the spectrum, when we're talking about diarrhea or loose stools, they can be caused just about, by any food. Chinese food can be bothersome. The hot foods or the Mexican food. Seems like it just varies from individual to individual. Again, if it could be lactose intolerance. A lactose intolerance and drink a milkshake or eat a cheese pizza, and next thing you know, you're cramping up and and running to the bathroom because you have a bad case of diarrhea. And it's only because of the lactose in your gut that's not being broken down. So again, you have to do a little detective work and try to figure out what's causing the problem. If you have high gut motility, a very active gut, that can result in diarrhea as well. You may have noticed this when you just feel a pain just shoot across from left to right or right to left in your abdomen. That's what we call a peristaltic contraction. Your gut is just active. It's basically doing the wave and moving all that food at a much higher velocity through the gut than it's supposed to be doing. And very, very bad. That usually results in the cramping and the pain associated with it, and a lot of gas and bloating as well. Some medications, such as antibiotics, like Augmentin. When my child was a baby and was on it, Augmentin, it just, the diapers were horrible. We had to draw straws to see who was going to change the diaper. So that's one medication that can be a problem, but there's a lot of others as well. As far as enzymes, it's just, again, it's the opposite of constipation. The zyme prime and the enzymes like amylase, glucoamylase, that break down starch can really help firm up those stools. And the reason it helps is because by breaking down carbs in the gut, when they're not broken down, tend to bring in water from within the gut. Whereas sugars, on the other hand, once a carbohydrate is broken down to a sugar, there are transporters in the wall of the gut that actually transport the sugars out of the gut and into the system. And when the sugar moves out, water moves out with it as well. So you get liquid and water moving out of the gut, which has a drying effect, which also tends to firm up the stools. So that's the benefit of breaking down carbohydrates in the gut. Not only just to get the sugars, which you need as a fuel source, but also to remove the water from within the intestinal tract as well. Food intolerances, again, we can talk about lactose intolerance. That's probably the most common. It can affect just about anybody at some point in their life. And it's easily remedied by taking a good lactase enzyme product. It's just a matter of how much you need to work with the particular lactose-containing food you're eating. But this usually shows up as loose stools, usually within 30 minutes to an hour after eating the material containing the lactose. There's also phenolic intolerances. There's gluten intolerance, which is not celiac. It's not outright celiac disease, but a lot of people have some problems breaking down gluten. Some people have problems with casein or egg whites or something else. And we're not talking about anaphylactic allergies. That's one thing enzymes are not going to be helpful for. So if you're allergic to strawberries such that you need to go to the emergency room and you can't breathe and you need that shot of epinephrine, that's something that's an out and out allergy that the enzyme is not going to remedy. But these intolerances, which are usually IgG mediated, not IgE mediated, can often be the result of just the gut not being tolerant of that particular food, and usually maybe to some particular enzyme just not working as well, or it just needs the enzyme working within the stomach and not before it gets to the GI tract. So that's the advantage of taking an oral enzyme supplement. Phenols are again, this is another lecture, and I think we have them listed on other webinars that are listed on our website. But phenols are things found in plants and vegetables, similar to salicylates, and that seem to be a problem with a lot of people. Sometimes it's like a certain wines, certain red wines, you may get a headache or stomach upset, and it may be due to a phenolic. Some foods are higher in phenolics than others, and those can be the problem foods that you notice. But enzymes, like a good enzyme product to help with that would be our no-phenol. And again, the xylanase. And there may be something else. There may be another undocumented enzyme activity within those enzyme blends that's helping with the phenolic. And we're kind of looking into that. We're not really ready to show our hand on that, but I think it's a very interesting area of research. Irritable bowel syndrome. This seems to be the fashionable gut problem these days. Is everyone says they like to talk about their IBS. But it is a problem. It affects over 55 million Americans, and a lot of these are women. And you now see the drug companies have taken note. You see the commercials for addressing IBS in women. And we really don't know the cause, but there does seem to be an emotional component to it. There may be a faulty brain-gut communication. Stress and anxiety and hormones can play a role. Especially in the cramping, the spastic colon type symptoms. It may be the emotional component of it. It's real, but people who are high-strung, who are undergoing a lot of emotional stress, seem to present IBS more often. Symptoms include diarrhea or constipation, bloating, cramps, gas as well. One of the things that doctors recommend is taking soluble fiber, the kind that you just, you spoon out into the glass of water and stir in. And that can be helpful, but you need to start slowly. Too much of fiber too soon, and that can be kind of painful. The fiber solubilizing enzymes like no-phenol may help the gut handle the fiber, and also the downside of taking soluble fiber is that it tends to increase the gassiness. So enzymes can help, again, with the allowing the gut to handle the fiber without all the gas. Diverticulosis, which is something I have. When I was scoped a couple of years ago, I got a clean bill of health, except that I had what's called diverticulosis, which is asymptomatic. There's no, you don't know you have it, and it's not really that much of a problem. It occurs in 10% of those over 40, and if you're over 60, half the population will have it. And all diverticulosis is, if you look at this diagram, these just, basically your gut just starts making little bubbles, little out pockets. And these are usually caused by straining or having gas, liquid, or waste in the gut. And I always think of the having those balloons and blowing up a balloon, and how you squeeze one part of it and you can get a little bubble to come up and stuff like that. That's kind of what I think is diverticulosis. And again, in and of itself, it's not bad. It's not harmful. What the problem is, that these just become little pockets where food and stuff and bacteria can fall into, and it can be a source of infection. And when that occurs, it becomes, the term becomes diverticulitis, which is that is a problem. So if diverticulosis is found, and I'll tell you what my doctor told me, you just said kind of avoid eating small fruits like strawberries with small seeds, or blueberries, which he told me that, and I just totally ignored it. I just make sure I chew them very well. Nuts and popcorn and stuff like that. Anything that can get trapped in these little out pockets and not be digested. Now, my thinking is, I take a lot of enzymes. I believe everyone should be taking enzyme products. So I rely on the enzymes to go in there in these little diverticula, excuse me, that's the proper name, and go in there and just break down anything that may have fallen in. So that's another reason for those of us who are 50 or older to be taking enzymes. Again, a high fiber diet. Fiber is there just to kind of sweep things along, keep things moving, and that's why. But if you've ever been on a high fiber diet, what the compliance rate is low because people just don't like the bloating and the gassiness that occurs. And again, if you use the right enzyme, the Zyme Prime or the Nophenol can help break down those fibers to you still get the helpfulness of the high fiber, but you're breaking down the fiber a lot quicker. So it becomes less of a food source for bacteria. Again, this looks like the same slide, but it's diverticulitis now. And this is when they get infected, and it can occur without warning. It's a very dangerous condition. You need medical attention. If you are having alternating periods of diarrhea and constipation with a high fever and a lot of pain, then you might be having a problem with diverticulitis. Again, high fiber diet is recommended. We say try to use an Nophenol to assimilate the fiber, and high protease enzymes may help as well. If anything, it might keep the inflammation, help with the inflammation as well too. Crohn's disease, very severe. This is not a good thing to have. There's several subtypes, and it's just has different names depending on what location in the gut that the inflammation occurs. And that's what Crohn's disease is severe gut inflammation. Diarrhea is prevalent. It's an autoimmune reaction. Basically, the immune system reacts against your own gut and starts trying to attack it. Contrary to what recommendation for diverticulosis and such, you don't want a high fiber diet with Crohn's disease because there's too much gut damage and the fiber's just too rough. So this is where you want a blender diet. Basically put everything in a blender and keep it liquid and smooth and soft, just so you don't rough up the gut any more than it already is. For the diarrhea, multiple enzymes can help with Crohn's, so this is something that needs medication or surgery or both. But the enzymes can help with some of the symptoms, especially if diarrhea is a problem and trying to firm up the stools. And it can also decrease the stress on the gut, especially if your gut is compromised, if you have a lot of inflammation, you're not going to be absorbing the nutrients out of the food. People with Crohn's often start losing weight dramatically because they're feeding, but they're just not getting the nutrients. So enzymes can be very helpful by breaking down the food and getting it to the elemental condition that can be absorbed by the stomach or the gut. Okay, again, this was just kind of a quick overview. We didn't go into too much detail because I just kind of want to introduce you to it. A lot of the stuff you can pursue on the net. You can Google all the keywords and get more details on these conditions. But again, to just kind of summarize, try to identify the problem. Look for patterns in the meals and the types of food you eat to see if they correlate with the problems you're experiencing. And then educate yourself a little bit as to what different enzymes do, and look for a product that is high in that particular enzyme you need to match with the food that's causing the problem. The nice thing is that if an enzyme product is going to help, it should help fairly quickly when we're talking about digestive problems. Gasiness and bloating, the BNO or the other enzymes, it's something that should help, just pretty much right away with that meal or after that meal. Usually the problem, people who have tried enzymes and say that they don't work usually aren't using one that's strong enough, or they didn't experiment with the dose. So please don't give up till you've tried different enzyme products or different amounts of the enzymes. You're not going to hurt yourself by taking large amounts. You can't overdose, you can't hurt yourself by taking large amounts of enzymes. And do get checkups and seek medical attention if any problems persist. So with that, I'm going to see if I can see any questions. And we did get a few ahead of time that I'm going to go over real quick. And in the meantime, Cindy, if I can stop showing my screen and turn it back to you, would that be the thing to do?
Well, why don't you, I would just leave the summary up, I think, for
Okay.
now, unless you have a contact, info contact screen. I think we forgot to
I mean,
put
I've
that
got
up.
my control panel, but I don't see any under questions or chat. I
Okay.
don't see any.
Well, I do have some questions I can
Okay, well, let me go through
read.
these that came through here.
Okay.
Um, Someone asked, do these enzymes work only in the gut? If a person reacts to gluten oh well, that's okay. Do these enzymes work only in the gut? The quick answer is yes, they work in the stomach as well as the gut, which is something pancreatic enzymes only work in the intestinal tract and don't work in the stomach. But these enzymes do, and that's a good thing. You're starting the digestive process a lot quicker when you take an oral enzyme supplement. And you can alleviate some of the food reactions because a lot of times the food won't bother you till it moves out of the stomach and into the intestinal tract. And if you can break it down or inactivate that food problem while it's still in the stomach, then you're way ahead of the game. And that's why a lot of our customers who are dealing with autism have found that they can add gluten and casein back to their child's diet in moderation by using enzymes to break down the gluten and casein before it gets into the GI tract. But and we can't go into a lot of detail, but there is some percentage of the enzyme you take orally that can get absorbed and can do some good, but they're short-lived. To get the systemic therapeutic effect of enzymes, you have to take a lot of it, and you have to take it frequently because the blood system circulation inactivates the enzymes very quickly and takes them out of circulation. I'm trying to see. Someone said if a person reacts to gluten via lungs, that's like they're harvesting wheat. If they're basically breathing in the lung, will enzymes enter the bloodstream, coming in contact in a way that moderates gluten reactions? It could, but it would take too long. The respiratory reaction would occur very quickly, and I don't think the enzymes would have a chance to get in there and affect that in a good way. Another question is how does food combining enzymes and HCl impact? And we talked about the HCl, that it's fine to take, but it may lessen the enzyme activity. But really, when you're taking an oral enzyme, plant-based enzyme, it doesn't require HCl to activate. Food combining, I don't know. I've tried to keep an open mind on that, but I try to keep things as simple as possible. And you know, nature produces foods that are already combined, so but I think that's just something that's varies with individuals. Some people find certain combination of foods better than others. But regardless, enzymes don't care what food is combined with another food. They're going to work on, if it's an enzyme that affects that food, it won't be inactivated or something by another type of food. Let's see. How does Houston Enzymes stand out from other enzyme products? Well, I'm biased. I think ours are the best. For one, there's no other enzyme company out there that I'm aware of whose owner actually has a doctorate in enzyme biochemistry, or who's actually worked, purified an enzyme, characterized an enzyme, and understands how enzyme works on a molecular level. If your enzyme company, if you mention the term Michaelis, Menten, Lineweaver, Burke, ask them to derive the Michaelis-Menten equation and see if their eyes glaze over or they look at you funny. Then that means they're not very educated about enzymes, because those are key words that any enzymologist would understand and know what they were talking about. There's other keywords, but if I get them out there in the public, everybody will look them up and pretend to be an enzyme biochemist. So I'll just keep them to myself. How do enzymes contribute to better health and possible greater longevity? Well, simple. You're getting more nutrition out of the food you eat, which means you can eat less food and watch your weight, and you're just eating better and getting more nutrition out of your food. So that's got to be a good thing. Okay, I think that's about all the questions I have. So if you have some more, Cindy, I'll try my best.
All right, I have a few. And before I read those, I accidentally sent that chat before I intended to, but I just sent a chat message that has Dr. Houston's email, and you can contact him directly there if you don't get your questions answered today. And his, I didn't get the main office number on there, so I'll add that in a minute. And here's my email and number too. Okay, we have a question. If you have a high level of long-chain fatty acids and low level of short-chain fatty acids, which enzymes can help?
Well, it's the short-chain fatty acids are actually the ones that are beneficial. Those are the ones that you try to get to. And short-chain fatty acids are actually derived from, or occur when triglycerides are broken down. A triglyceride could be considered a long-chain fatty acid, and the lipase enzyme is what will break those down into the short-chain fatty acids. So that's what you want. You really don't want the long chains, you want the short chains. So a good lipase product would be, a good enzyme product that has lipase would be helpful in that respect. You don't need a whole lot of lipase. It tends to work pretty quickly, and I think some people get a little crazy thinking they need high amounts of lipase, and a little goes a long way, and it lasts a long time too.
Okay, we've got a lot, and it's kind of hard to sort through them here. Would protease enzymes be appropriate with the irritation present in Crohn's?
You got to be careful there. It's sort of like there's two things. Remember how some cultures and medical cultures will use leeches to debride a wound. They'll put that on a wound, and it helps the healing process. Well, what the leech is only getting rid of the dead necrotic tissue, and proteases are only going to work on the same way. They'd rather break down denatured protein, which is what dead tissue is. And so what they're doing is they would be going through and kind of cleaning up the necrotic tissue, and also maybe exerting. There is evidence that proteases have an anti-inflammatory effect. The problem is that a lot of proteolytic enzymes can inhibit blood clotting when you take the protease enzymes in very high amounts or very frequently. So, and also there may be some pain. Now in an adult, this may not, who's aware of what's going on, this may not be that much of a problem, but in a child that has a lot of gut damage or bleeding ulcers or something like that, ulcerative colitis, it might be kind of painful. It'd be like, you know, putting lemon juice on a wound or salt on a wound. It would just be irritating. But I can't say that it's bad, but it may not be the thing you want to do at that time. There may be other things that are to do first to get the gut in a better condition.
What about eczema? Any connection to digestion?
A lot of the stuff we call eczema is simply a skin reaction to wheat and gluten, and often if you take the high protease, the DPP4 containing enzyme products, it'll break down the gluten, and to a point that the body doesn't react to it, and you don't see those eczema-like patches.
Okay, and I just put up your phone number now too. I didn't get that on there before. Here's another. Are you still there?
Mm-hmm.
Okay. Here's an. Okay, yeah,
Over to you.
wasn't sure. Can I take enzymes if I have yeast or fungi sensitivities, because I heard you make them from such? We get this question almost daily.
Yeah, almost every plant-based enzyme, regardless of the company that sells it, those enzymes are going to be derived from either fruits like papaya or pineapple, or the great majority are derived from aspergillus type enzymes, fungus organisms. The thing is, the enzymes though are something that's secreted by the fungus. That's how the fungus gets its nutrition. It'll grow on a tree or something, and it'll secrete or squirt out the enzymes to break down whatever it's growing on, and then it takes the byproducts of that breakdown and uses it as a nutrition source. And we don't grow mold or fungus. That's all done in Japan, where the enzymes are actually manufactured. And I've actually been over there a couple times. I've seen how they do it. It's a very involved, complicated process, but they're basically purifying the enzymes from the fungal material. And the very first step is they have these trays of fungal growing, and after a certain point they dump them in, and basically it's a centrifuge. It's something like your washing machine, and how it spins at high speed, and in your washing machine the water is separated from the clothes. Well, in that process, the enzymes would be the water and the clothes would be the fungus. So the very first step is separating the enzymes from all the solid fungal material. And then there's about a dozen other purification steps used to make a very highly purified enzyme product. So while they do come from fungal material, there is no spores, there's no fungal material left. There's just the very purified enzyme protein. And many people with mold allergies can take enzymes with no problem. The part of the fungus that people are usually allergic to is on the outer part of the fungus, the body of the fungus, which is removed in the first step. So it's usually not a problem. But having said that, enzymes are proteins, and anybody can be allergic to any protein. So we've had a couple of instances where people have found out they're allergic to a certain enzyme protein, which doesn't mean you're allergic to all enzymes. And it may be why it's a good idea to check around with different companies, because different companies produce products with different combinations of these enzymes. There's not that many different enzymes out there to choose from, but you can have different amounts. Products can have some enzymes and others don't. We try to use a minimal amount of different enzymes per product, and that way we can use large amounts per capsule. So you're getting a more potent product per capsule, and also decreases the chances that we're including an enzyme that someone might be allergic to. So that's one. Don't be impressed by a bottle that shows 20 different enzymes on there. Some of them are needed. Some of them, to be honest, being involved in the enzyme industry, I know there's some enzymes that are just out there that are what we just call filler. They just add cost to the product and they really don't have much of a benefit. So anyway, there's a lot of products out there to choose from, and so if one doesn't seem to work, you can always try another one.
Can you use enzymes instead of a gluten-free and casein-free diet in those with sensitivity? Many of my patients tend to not want to eliminate when advised to do so, as clinical info leads to my suspicion of intolerances.
Yeah, that's a loaded question. I'm first and foremost a scientist, and I go where the science leads me. And I invented the first enzyme product that was targeted for the autism community back in 1999. And it was soon after I became convinced that that some children with autism, not everyone, but many could possibly, if since the problem with gluten and casein came down to just the peptides that derive from the gluten and the casein that occurred during normal digestion. And if you changed the way the gluten and casein were broken down during digestion, you changed the effect of those proteins, or you diminished or decreased or avoided the effect. So I started talking that up, and I ran into a lot of criticism by conference organizers and some doctors, basically saying that I was defeating the message they were trying to get out there to parents, which is, go on the gluten-free, casein-free diet. But I know a lot of parents, and we weren't anti-diet. We were just trying to point out that the problem with those foods could be eliminated in many cases with using the correct enzyme to break down the gluten and casein. So that was our point, because we know a lot of these parents are under a lot of stress. The diet is hard. There's no way to sugarcoat it. So Cindy is a perfect example. She was my very first customer. Her child was on the GFCF diet for a good year or so, and they basically gave the enzymes a good test and found that they could go off the diet with the use of enzymes. The first couple of times we just wondered if it was a fluke, but we've had many families tell us that the enzymes have been a lifesaver as far as allowing children to eat more foods, different foods, go off the diet, have a social life, not be made to look different. And from a physician standpoint, you have to realize that compliance is a problem. And if you have a new patient that has not done the diet yet, a good thing to try is to try the enzymes for a month or two and see what kind of improvements occur. If you see good improvements, then that's a good indication that the diet would work as well. So you might tell the patient in which the enzymes work very well. You'd say, well, this is an indication that if you can try to limit the amount of gluten and casein in your child's diet, you're going to see some benefits. Now, the enzymes may be taking care of everything, but it wouldn't hurt to try to minimize, but you don't have to worry or agonize that you're 100% GFCF, which I think is an impossibility, by the way, but that's my opinion. And it's not just gluten and casein that are problems. There are other peptides, proteins that contain these same exorphin peptides sequence. It's just a 7 amino acid sequence that's found in a lot of different proteins. We know soy has it. Spinach leaves also has it. So these are just the foods we know of, and there's several others. There could be more foods out there that are just as problematic. So we're all working toward the same goal, is try to help these kids. Excuse me. But if the diet is what it takes, then they should do the diet. If the enzymes help, then I don't see any need to criticize, and we certainly shouldn't treat the parents as being dumb or not being able to understand the problem. They will do anything to help their child, and they will learn and educate themselves as well. So I don't think we have to worry about confusing parents. I think if we explain it well enough, they understand. So we believe in choice, so it's just another tool. Enzymes are another tool that one can have advantage of, and I think it's up to the parent to decide how they want to raise their child, and that extends into their diet as well. So that's my soapbox for now.
Would you recommend Trienza for gas and bloating, or is it better to target with a single enzyme?
Well, again, depends on what's causing the bloating and gassiness. For example, if it's just when you eat dairy, then it just may be a lactose intolerance. Uh, if it's with cauliflower and broccoli, then it's the stachyose and raffinose, the carbs that in there, so you need something with alpha-galactosidase, something like Beano or similar type product. So again, if you have no clue, you can try a multiple enzyme. Just keep in mind that the more enzymes you see on the label, it means you either have to take more capsules or larger capsules to get as much from a product that has 3 enzymes in it. So again, it just depends. I'm rapidly losing my voice.
Can you take another question?
Sure.
Okay. If an elderly person has stomach discomfort, burning, in addition to a constipation pattern, would you still try the carb enzymes to give relief to the stomach?
Well, yeah, we can try it. We do have a modified carbohydrates enzyme called Zycarb, which does address carbohydrates and starches, but we added a little bit of the nophenol enzyme to it. So that would be the way. If you're going to try something, if you need help with carbohydrates and constipation is a problem, then we try to steer people to the Zycarb. Sometimes combining 2 products like Zyme Prime or Zycarb plus the nophenol, and that works in combination. You get the help with the carbohydrates, and the nophenol will balance out the stool forming problems or affect the Zyme Prime. So again, there's a lot of experimentation, and everybody's different, so it just takes sometimes a little bit of work to find out the right dosing regimen.
What type of enzyme would help with soy intolerances?
The AFP peptide, definitely. It's a soy protein that's causing the problem, so you need to break down the soy protein. So you use a high protease enzyme product, like the AFP peptide.
I'm looking here. It's hard to sort through these the way they're set up this time. How late after eating a dairy product, for example, can I take the enzyme?
Well, you really want to try and take it before you eat the dairy product, but certainly as quickly as you can get it in, the better chance you have of alleviating some of the problems. Usually if you can get to the enzymes in 20 or 30 minutes after ingesting the food, then you've got a good chance of stopping the reaction.
Can enzymes be taken together with probiotics? And are there any supplements that you would not recommend taking together with enzymes?
Yeah, we get the probiotic question a lot. I've seen no evidence that enzymes are harmful to probiotics. The thing that hurts probiotics the most is stomach acid. So you try to take the probiotics on a full stomach, and enzymes aren't. I don't see how they would hurt probiotics. The pancreatic enzymes live in perfect harmony with the enzymes present in the GI tract, so in nature they occur together without any problems, so I don't see it being a big deal. If you're really worried, you can always take the enzymes at the beginning of the meal and take the probiotics at the end of the meal, and should have no problem. The probiotics don't work in the stomach, they work in the GI tract, so then there's really no timing issue with the probiotic. You just want to get it into the GI tract. And if the enzymes are diluted with the stomach matter, then the chances of it running into a probiotic and doing any damage is very small. So
I'm not sure if I already covered this question, or if you addressed this in another question. Why do some people have a higher than normal yeast level in their gut, and what would you recommend, especially if it's a long-term condition like in an autoimmune?
Wasn't there a previous yeast question? I don't think I really got around to the yeast part. Oh no, that was about where they were derived from. Yeah.
Okay.
I'm sorry, say that question again. I got off track.
why do some people have a higher than normal yeast level in their gut? What would you recommend, especially if it is a long-term condition like an autoimmune conditions?
Mm-hmm. Well, for one thing, there's two things. You want to treat the fungus directly with nystatin or diflucan, and there's nothing wrong or bad with using those medications if they're required. But yeast problems can be persistent, and one thing you can use to keep them to a minimum is by keeping the gut in a healthy, clean condition, and the enzymes can do that. It also removes any food source that the fungus may use as a source of food. So the quicker you digest the food, or the more thoroughly you digest the food in your gut, the less food source there is for the fungus to use. So combination of enzymes, I guess all of them. You want to break down proteins, carbs, and fats. You don't want to leave anything hanging around for the fungus to grab a hold of and start chewing on. So first thing to do is try to get rid of it, and usually you need medications to get rid of the fungus, and then you want to keep flare-ups to a minimum by starving out the fungus and taking probiotics to keep the good bacteria. The good bacteria will crowd out. Again, it's competition for the resources. So if you have good bacteria crowding out the fungus, then you're way ahead of the game.
We have a few other questions, but I think they might be better asked directly to you. So if we didn't get to your question, like I have some people asking about specific products, and tests and things, so you all might email Dr. Houston privately or give him a call. And with that, I think we are finished for this evening. Do you have anything else to add, Dr. Houston?
No, just keep in mind that we can do these webinars very easily and very quickly. If you have a specific problem you'd like to see if we could address in a future webinar, please let us know. Email Cindy and let her know.
And if our recording was successful, which it looks like it was, we will post it on our site next week. There will be a notice on the home page, and it will be archived in the Learn About Enzymes section. Meanwhile, if you would like a copy of the slides, email me, and I posted my email address there. You'll also get an email from me tomorrow, an automatic email, so you can look at that email and it'll tell you how to reach me. Thank you all for attending, and please do contact us if you have any additional questions. Good evening.